the New Zealand High Commissioner to Fiji, Your Excellency, Mr. Jonathan Kerr, senior officials of the New Zealand High Commission, Permanent Secretary of Health, Dr. Fong, Chief Medical Advisor, Dr. Tunrabu, and our senior officials, and Director of PBS, ladies and gentlemen. Today marks another momentous day in our fight against COVID-19 and the pandemic when Fiji receives the vaccine to be able to protect our young children, and obviously with the support of the New Zealand government. And this is not only the only assistance we have received from the New Zealand government, and New Zealand has stood by Fiji during this pandemic and supported us in many ways. And I want to talk about some of this support. The support of the most acute needs at the start of the outbreak in Fiji through the New Zealand $40 million in emergency fiscal crisis financing, the assistance with the medical equipment such as the airborne and other critical care items and supplies, the 100,000 AstraZeneca doses for the adults aged 18 years and over, medical personnel including members of the ANZ Med team, as well as $22 million in operational funding, equipment and support to civil society partners. Fiji is grateful for the continued support of the New Zealand government in the fight against this COVID-19 pandemic. The first batch of the Pfizer COVID-19 vaccines received from New Zealand are assigned to be administered to children aged 12 to 14 years old. So I'm thinking this morning about my 14-year-old, and thank you that this vaccine will include him. Thanks to the New Zealand government, our children of Fiji will receive protection against the deadly COVID-19. While we know that COVID-19 tends to be milder in children compared with adults, it can also make children very sick and cause children to be hospitalized. In some situations, the complications from infection can lead to deaths, and we have unfortunately witnessed deaths of children due to COVID-19. Hence our willingness to pursue the protection of our children too. This donation of Pfizer vaccine now gives us the opportunity to provide the best protection to our children who are the future of our country. There are many reasons to getting vaccinated, and the most important is the protection of our children from becoming sick, being hospitalized, or facing other deadly consequences from the virus. Vaccinating children aged 12 years and older will help keep them safe in school, safely participate in sports, and do other group activities. But most importantly, also protect children who have not yet been vaccinated and below that age group. Vaccinating children will also protect family members, and as I've alluded to, including their siblings who are not yet eligible for vaccination, and family members who may be at increased risk of getting sick from COVID-19 if they are infected. As of the 20th September 2021, the Ministry of Health and Medical Services took a step forward in vaccinating children aged 15 to 17, and to date, 33,037 children have received their first dose, while 22,117 have received their second dose of the COVID-19 vaccines. And given the successful vaccination in children, nationwide schools have opened for year 12 and year 13 in a safe environment, and vaccination is a very important component of that safe environment. We cannot let the pandemic continue to affect us, to stop us from moving forward. We have the tools to win against the virus. We must do so with all caution. The best defense against this virus is vaccinations. Vaccination helps save lives and help protect our children. To date, 599,016 of Fiji's adult population have received the first dose of the COVID-19 vaccine, which is 96.6% coverage, while 449,380 have received the second dose, or 87.7% coverage of those who are fully vaccinated, the adult population. I want to digress by saying that there is a large New Zealand diaspora in Fiji. There's also a larger Fijian diaspora in New Zealand. Some of them are doctors, some of them are mechanics, some of them are nurses. And thank you for this vaccination. You are vaccinating the next all-black player from Fiji. We are indeed grateful to the government and people of New Zealand for the tremendous donation and assistance towards our COVID-19 response. And we look forward to continuing our partnership as we work towards protecting our peoples and returning our countries back to safe as they were before. Nawalibu.
The Honourable Minister, Dr. Ifereimi Waqainabete, Minister for Health and Medical Services, Dr. James Fong, Permanent Secretary for Health and Medical Services, Dr. Jeremiah, and senior officials from the Ministry of Health, members of my team from the New Zealand High Commission, ladies and gentlemen, tēnā tātou katoa, ni sampula vanaka, namaste. It's a great pleasure to be with you this afternoon for this handover to the Ministry of Health and Medical Services of the first batch of Pfizer COVID-19 vaccine to support Fiji's vaccination rollout to its 12 to 14-year-olds. As we've seen during recent COVID-19 outbreaks, both in Aotearoa, New Zealand and the Pacific, Delta doesn't discriminate. We are sharing Pfizer with our partners in the region to help protect our tamariki, our children, against COVID-19. Aotearoa, New Zealand is heartened to see Fiji's COVID-19 situation has improved markedly in recent months, and it's a wonderful testament to the work of officials in this ministry and across the government. This donation will support the Fiji government to continue the commendable work it is doing with its vaccination rollout, with previous rollouts of AstraZeneca and Moderna in the older age groups. And I also wish to acknowledge the partnerships that have been forged between Fiji and the governments of Australia, the United States and Japan, for example, for their support to Fiji's high-quality vaccine stocks. With close to 1/3 of Fiji's population under the age of 18 and therefore not eligible to receive an AstraZeneca vaccination, the Pfizer donation will make a tangible contribution to vaccination rates and COVID-19 resilience in Fiji. Vaccinating the 12 to 14-year-old age group adds another layer of protection in the fight against the virus. And hopefully, in time, there will be the necessary regulatory approvals that will allow even younger children, perhaps down to age 5, to also get a vaccination. High vaccination rates across the population are a key defence and essential to protecting those who are more vulnerable. Equally important, vaccinating this age group supports the safe return to school for children after a year in which their education has been severely disrupted. And with schools having been closed for 6 months, the ability to resume study in a normal learning environment will contribute to overall health, safety and well-being. Careful planning has taken place to make sure that together New Zealand and partner countries, such as Fiji in this case, are ready to roll out Pfizer. In addition to the Pfizer vaccine, New Zealand is also providing related consumables, vaccinator workforce training and guidance on effective vaccine storage, continuous temperature monitoring and distribution into remote areas. Due to temperature and other requirements, the logistics of delivering the vaccines are complicated and that does require careful planning. And I would like to acknowledge all those who've been involved in ensuring the safe handling and transportation of vaccines from New Zealand to their destinations in Fiji. And I have had a little bit of the flavour, although most of the hard work at our end has been done by my colleagues in the High Commission and by officials back home, but also to acknowledge the tremendous hard work that's been taking place in Fiji by Fijian officials. Dr. Chamesa, I know this is something you have been working very hard on, along with Dr. Jeremiah, Dr. Fong as well, and of course the Minister, to make sure all the necessary arrangements are in place for the safe arrival of these vaccines and their distribution. Since the start of the outbreak in April, New Zealand has supported Fiji to respond to its most acute needs and priorities by providing around 40 million New Zealand dollars in emergency fiscal crisis financing, 100,000 AstraZeneca doses, personnel support, as well as over 22 million New Zealand dollars in operational funding and equipment and support to civil society partners. New Zealand's close and trusted partnership with Fiji means that we've been able to respond quickly to provide support where it's needed since the beginning of the COVID-19 outbreak, and we will continue to do so wherever possible. I wish you, Minister, Permanent Secretary and your team all the best with the rollout of the Pfizer vaccine and look forward to our continued partnership. Ngā whakalevu.